Thank you so much. And thank you, Lauren and Lucy, for inviting me to participate in this fabulous seminar. Now, I have the difficult challenge to be the last after these three fabulous speakers and presentations and try to say something different and contribute something more to the discussion. For that, we're going to turn full circle and return to Colombia, where we started in our exploration, and but this time to Bogotá and to a quite different housing context than what Lirio started talking about in the beginning. Now, I have to say, I'm not an urban planner. I'm an urban anthropologist, and so and I've not explicitly researched on home or housing in the sense we're discussing here, but I've worked on domestic employees and especially their commuting, their experience of space in Bogota, and on social housing projects in Bogota and the conflicts, especially in these communities. And so I've kind of drawn from these data to talk about the issues we're discussing here today. Now, as was already said, of course, Colombia was hit the same as everywhere else by the pandemic. I don't think there were, in the beginning, there was very much this discourse also like, oh, we are all in this together. But of course, very quickly it turned out it's not the same for everybody else to experience the pandemic in a city like Bogota. I have to say, Lirio mentioned it, in Bogota, we had from March till more or less September of 2020, a very strict stay-at-home mandate, where at least in the beginning until August, if I remember correctly, we were not allowed to go out unless we went shopping. So people could walk their dog, but for example, children were not allowed to go out play in the park. We could not go for a walk. So that was really strict confinement. Gradually, then there were exceptions introduced for certain occupations to return to work, but much of 2021, even we passed with very strict limitations on economic and social activities. And so, especially in this very strict phase of the home isolation, this vital importance of housing and living conditions was highlighted. Why doesn't this continue? Sorry. So I want to stress kind of like 3 points. One is informality, which affects especially the domestic workers I worked with. So during strict confinement, especially strong was this experience of the feminization of domestic work, which expressed itself in 2 to 3 additional hours of household work. And I put that in quotation marks because it was the all kinds of other elements from education for the children that they had to take care of, etc. So it was not just the classically defined or what we usually popularly understand as household work. But then also this infection, greater infection risk if people had to go out to do shopping, the essential errands that we were allowed to do, in the time when there was no vaccine, and Colombia was quite late until we really started vaccination. And then one of the important things, and I'll explain more of this in a second, is the labor condition of women, the domestic workers I work with. And so I really want to stress that local labor conditions actually negatively impact on women's experience of home. And I think that's one of the points that has maybe not so much been emphasized so far, that we have to think the home in context or in combination with labor conditions too. And so it's the lived labor conditions, the relations with the employer that affected very much the women in their experiences during the pandemic. So for example, despite being obliged by law, Colombia actually has quite progressive or good laws regulating domestic work. However, almost 80% of the women still work informally, even though they should receive social security benefits, etc. Most work informally because of the labor market conditions. There's such a demand. Almost 50% of Colombians have informal labor contracts or labor conditions. And so women are happy if they can find work and are not exceeding the regular regulations or their rights, and often are not even aware of their rights. So even though people are employers are obliged by law, actually the majority of employers did not pay their domestic workers while they could not work during strict confinement. So women did not receive any salary. Even more, some employers actually fired their domestic workers against legal regulations. It's not a reason to fire them just because they couldn't come to work because of the greater circumstances, and did not pay the obligatory surance money. Now, when the restrictions were slightly lifted and the domestic workers could return to their work, because employers were worried about being infected, they actually presented a choice to their domestic workers, say, well, you stay during the week with us, you live with us, or you don't need to return to work. So because then there would not be daily commuting in the bus, which was considered one of the prime dangers of being infected by COVID. And so this choice was actually not really a choice for the women because of their economic situation. Since they did not receive any salary, they kind of had to accept these conditions and started living with their employers during the week, which meant that they had to leave their dependents, children, often minor children, elders, husbands, to their own devices in their own home. Now, in addition, according to law, employers are also required to provide domestic workers with all the necessary work equipment. In a pandemic, that would include face masks, gloves, all the gear that supposedly protected us, which many or most employers actually did not. And so that also then presented an additional cost expense for the women. In addition, many of the domestic workers who could return to work, they had prolonged working hours. First of all, because there was limited public transportation, they kept the numbers low, the people who could enter the buses, etc. They were less frequently running. And then there were the additional cleaning and disinfecting tasks. You remember at the beginning when we disinfected everything that came into the house. So that added substantially to the work that the domestic workers had to do, and they did not receive overpay. So I want to just mention a few cases or a few examples of women to show how different, despite these general conditions, how different the experience was. It's so hard to always to generalize about the conditions of or situation of women. So for example, Rocio, she lives with her grown-up children in a family-owned building. Now that sounds very landlord-like, but these are very simple housing, very often or mostly self-constructed houses in more or less informal neighborhoods of Bogotá. She also received an income from 2 rented rooms. Again, not the landlord association or image we have. It's like she rented out rooms in these relatively simple house that they owned. Now, she was lucky because she had 2 adult children who had stable employment and who were continued to be paid during the strict confinement, and so they paid for the household expenses. But that made Rocio even more feeling obliged to take care of all the cleaning, the washing, the cooking, everything that had to be done in the house. And also the shopping, which then exposed her to higher risk. And at her age, of course, it was actually, she is more at risk for being infected. Still, this was a relatively okay situation, let's say, in the scale of experiences. Another case is Christina, who was in her early 40s. She lives with her husband and 2 small children. She has also adult son from a previous relationship, and they own again their house, again in a relatively informal neighborhood of Bogotá. She actually managed to receive government cash transferences and also received some grocery vouchers while their children could not go to school where they would normally receive lunch. And so because they didn't receive the lunch in school, they got these food vouchers. She had worked in 2 places, but only one of these places continued to pay her. And so there was financial strain, especially because the expenses for utilities and their mortgage payment continued during the pandemic. And so to continue to reduce the expenses, she canceled her telephone services which they have not been able to recover until today. And actually, many of the women we worked with before the pandemic, we tried to contact during the pandemic and were not able to, because many of them actually canceled their telephone service. That was one of the first things they did. Many did to cut costs. And then we have Lady, who was 56 years old. She lived with her infirm husband who could not work. And she had no income during the strict confinement. Before the pandemic, she worked in several households, but none on a regular basis, and none of them paid her during confinement. She also engaged in recycling, meaning she walked around the neighborhood or even further to collect things from trash she could sell. But she stopped doing that during the pandemic, also to protect herself from being infected. So again, the couple depended on Lady's adult children who also recycled, but they continued to work during the pandemic or during the strict confinement period. She was not able to sign up for any of the government programs or for any other help from organizations, but she was lucky because she had relatively good relations in the neighborhood. She was kind of like a community leader. And so she received some unsold and damaged products from local shops that she shared then even with her family members. So very dependent on the help of others. And then we have Johanna, and I just mentioned this as an example, a relatively young, who lives with her 3 small children. And so she was continued to be paid during the pandemic. But what I find interesting, she says it was a gesture of solidarity. No, it's a law. It's a legal obligation to continue to pay her, which shows the lack of awareness or knowledge about their rights, actually. So in general, we have challenging living conditions for domestic workers and their families, but they were, of course, exacerbated by the pandemic, especially during the strict confinement period. And so we have lack of sustenance in Colombia. In May 21, 37% of Colombian households could not afford 3 meals per day. Closed schools meant that children missed out on their school lunch, which for many families in the lower income classes are highly important or are one of the main meals they have per day. In addition, you have 8 million students in public schools that did not have access to a computer or internet and thus could not follow virtual education. And then the economic difficulties forced the women to return to work as early as possible when we still did not have vaccination, etc., which exposed them to higher risk and also made the women accept these very unfavorable working conditions. In addition, they suffer from the overburdened and underfinanced public health system. So domestic workers lack social security and protection, supposedly guaranteed by the Colombian government, but not enforced. And so they really relied mainly on personal support networks, children, parents, cousins, partners to alleviate their needs. And so we see feminization and devaluation of care and domestic work, both paid and unpaid, which causes, as Yasmina also mentioned in the beginning, economic, physical, and emotional burden on women. And this has been exacerbated during the pandemic because of the women's increased challenges and responsibilities. And the point I want to make really is that the experience of home is inherently thus connected to labor conditions and intersectional socioeconomic and spatial inequalities. And I see I'm running out of time. Now I wanted to mention the insecurity of peripheral living. This is one of the neighborhoods where several of the interlocutors in our research lived, in the very far south of Bogotá. These areas, this is actually Ciudad Bolívar, the photo I showed you before, which is down here, the red zone, Ciudad Bolívar, which has the highest rates of homicides in Bogotá. And so we can understand that women feel very unsafe in their neighborhoods. In this statistic, we can see that 48% of women feel insecure in their homes. The first reason or the 48% is because, for example, they don't even have a lock at their house. Or 44% they have no means to communicate, to be in contact with somebody else, ask for help, etc., etc. And so in these peripheral areas, we have higher crime rates. There is a general distrust of even neighbors and a general anonymity of living experience. Many of the women say they don't talk to their neighbors, they don't even know them, they don't trust them. And so women especially feel unsafe, not only in the neighborhood, but also in their homes. And so this lack or this feeling of insecurity during the pandemic was even further made worse because of the lack of people and traffic in the streets during strict confinement. And then there was this whole discourse of insecurity and blaming the recent Venezuelan migrants for committing crimes. There were also protests over the lack of government support, which all contributed to making women feel even less safe in their homes. Now, I only can mention very quickly the overregulation in social housing projects. We have these social housing projects in the peripheries of Bogotá, which are very standardized, industrially produced, large gated communities. And I'm going to skip all this. Unfortunately, much of this Rachel already mentioned, these very normative environments, which you cannot adapt to individual needs and desires. These are some photos. And during the pandemic, these structural deficiencies or shortcomings of these neighborhoods became even more strongly noted, very small and very little adaptable units with thin walls, no insulation. There was a suspension of construction. These these apartments are normally handed in to the buyers without any kitchen, bathroom, etc. And so, since everything was suspended, people actually lived in these unfinished houses. And the surroundings, there's no shops, no schools, no infrastructure, no buses. And since construction was suspended during the strict confinement, this didn't progress either. And so people really lived incredibly isolated in these environments. And so there were even more conflicts than usually in these homes over these structural problems. In addition, in these gated communities, social housing gated communities, you're not allowed to have any business going on, but people needed to have some income. And with the restrictions, it was really hard to have some income. Many of these people also have informal employment, and they couldn't engage in any kind of business, even from their house, because it's so highly regulated. Now, two things that I want to mention as transversals is the very high domestic violence, which was also mentioned before. Between March and April of 2020, we have the number of calls for the violence hotline increased by 142%. 90% of these calls are made by women. And the reasons are, of course, that being trapped with your aggressor, lack of denunciation or social control, and then the entire stress situation, alcoholism, drug abuse, etc., contributed also to increased numbers of domestic violence. And just maybe on a more positive note, we could also see in the social housing project, there were spontaneous practices of help. So it is possible to also see these spontaneous support practices of care within these communities. And just to finish, what I really want to stress here is that urban social housing policies, which are so standardized, so industrialized, and so inflexible, that was also the point that Rachel made, and labor conditions negatively affect low-income populations, and especially women. And thus, home was at best a shelter, but very often a trap. And so I really think that for urban planning, we need to think of care policies, but also labor policies to foster vital communities that are prepared for similar events in the future. And that's it.